So, hi, Lucy and Shannon. Are you guys there? Oh, hi, Lucy. Whoa. You came and you went away. Hi. So, should we be seeing you? Or
Lucy, you're still on mute.
I am okay now. Can you hear me?
I can hear you and I can see you.
I'm gonna hide me now.
Yeah.
Oh, okay. But so they're not going to be able to see me either? I mean, I'm fine with that.
You can put your camera on.
I just don't think they want to see us.
Yeah.
Right. I mean, I might kind of hide too. So I don't know how to do that though. So we'll just, okay. And Bonnie is not coming to talk tonight. So I don't need to do that. Okay. So Shannon, we were going to test how to make you a speaker.
Oh,
Promote,
calling in.
yeah, how I could promote you to.
Okay, let me call in and see.
Okay. Okay.
I'm gonna mute me here and call in from this number.
Okay. All right. Those attendees. Attendees names alphabetically. People can see your screen. Okay. People can see you. Okay. Can they though?
Okay, now I'm in as an attendee in listen only mode.
Okay, I don't see you yet.
So I can hear you on my cell phone now
Uh-huh.
and
So,
through the computer.
okay. I mean, trying to see how I might promote you. What did we see on that? Oh, I've kind of got to go.
So
Do you
so does my phone number come up at all?
No, I'm only showing that there's 3 of us here. Karen Carroll as the presenter. And it says my camera's on, but I can't see me.
It looks like your camera's on, but I can't see you either.
I know.
But I'm definitely in this meeting from like an outside person would be.
Okay. And you can speak. You called right in. Maybe
Yeah,
because
I mean, I can't, so let me mute me here and
did you
see.
call the panelist number? Maybe you called the panelist link number, which will be different than the registration for the general public.
Okay, so
Okay,
I
so you want
called
me to
this
give you the number? I can give you the regular number. What number did you call?
I called this 562-247-8422. And then I put the access code that's on this agenda.
Okay, well then, there you have it. Here you are. So let me see if I can mute you. Can you try to talk now? Okay, that seemed to work.
Yeah, you muted me as a panelist, but I'm also here on my phone like a regular person, you know, like
I
if I
don't-
wanted to raise my hand.
I
Oh, but
don't-
maybe that's why, because I can't raise my hand or anything because I'm in from just the phone.
Yeah, but I don't see you. I see attendees 0.
Yeah,
So
that's,
I'm not, attendees can view the attendees list. Attendees can ask, all right, I don't know. I mean, I've got it so attendees can raise their hands. Let's see what happens. I mean,
yeah.
edit your name, preferences, labs, leave the webinar, options, view. Yeah, okay, well. So I should probably, once they start the meeting, I should mute myself. It just seems weird that people can't see me if I'm talking.
That is kind of weird. I don't know why you're not being seen. Is something, so I saw on your camera before, it looked like there was maybe like a sticker over the front. Is that maybe?
But I mean, it's worked before. It's just like a screen.
Oh, okay.
Yeah, I just took it down. That's not, yeah. It must be, I don't know, looking for a different camera or something. I mean, I don't really care. They don't need to see me, but it just always feels weird if I'm giving my report.
To not be, yeah.
Yeah. But whatever, we'll figure that out for next time. Always in the front, preferences, stop sharing. Okay, view everyone, view who's talking. Okay, I'm talking, so, yep, but you're not. Hide webcams. All right, you've hidden your webcam, but you're still sharing. Okay, whatever. Can you guys see the agenda on my screen?
Not anymore. Before I could.
Okay, let's try to at least get that back. No one can see your screen. Okay, let me try this. Screen sharing.
Now I can see it.
Okay, great. That's the main thing. Maybe I could try to move it up a little.
Yeah. Yeah, perfect.
Okay. All right. So as long as you can see that, I wonder if it's looking, the webcam is looking from this monitor. You know what I mean? Like the
Yeah, like it's
webcam.
using itself to look at the screen instead.
Yeah.
Could be.
Yep. Whatever. Okay, let's see. Make another attendee the presenter. So I'm not gonna need to do anything to the board, just leave them unmuted, right?
Yeah, you don't need to do anything for them. They'll come on and pretty much run their meeting. And then as long as we have the agenda up, and then I think you do the COVID up or the,
Yeah, I'll do the COVID and the Health and Human Services update.
yeah, and then I think that's pretty much it.
Okay. Dr.
Yeah.
Green texted and he has some work stuff and is running late. So I don't know if, yep. Lucy, I also, for my update, I've written it down. So I'll be just, reading from my notes and I can give those to you tomorrow. So don't worry about taking notes for my update.
Okay.
Yeah, I just don't know how to get the camera working, but, so are we gonna be able to see the board members?
Yeah, they're usually on camera.
So how is that gonna work? You've hidden webcams, but you're still sharing your webcam. Okay, well. Very strange.
Hey, Karen, can you hear me?
Hey, Hi, Robert. I can hear you,
Okay, great.
but I cannot see you. Can the others see Robert?
Here, give me a second. Let me just clean up my room for a second, and then I'll turn on the
Oh,
camera.
sure. No,
Okay.
you don't have to. You can just
No,
be
no,
on.
I do. Yeah, I will. Yeah, just give me like 2 minutes.
Sure.
Okay.
Um, Shannon, can you see Rob's camera at all?
No, I think his camera is off.
Right, okay. So you can't see anyone right now.
No, so only if they turn it on, I think I'll be able to see.
Okay. So we'll see what happens. What if
Now I can
Screen-
just see your desktop, not the agenda.
okay. What about now?
Still just the desktop.
Okay, so it's pulling
Oh,
clear.
now I can see it.
Okay.
Now I can see it. You just need to make it bigger and then scroll down a little
Okay.
so that we can see the words.
Yep. Okay. Is the angle okay, or do I?
Yeah, it looks good.
I think what's happening is the camera or something is looking at this monitor. And
Yeah.
so the webcam, like it's telling the camera on this monitor where the agenda is to look at the, to do recording, but there's nobody there. And I don't know how to change the web camera. So
Yeah.
I'm not gonna mess around with this. People can see you. You've hidden webcams, but you're still sharing. Oh, now I
Hey.
can at least see Rob. Hello, Robert. How are you?
Good, good. Just have to make the background a little clean. So,
Not a problem. And I don't know why my webcam isn't working. So
okay.
preferences, I wonder. Integrated camera. Oh, whoa. I think I might have just figured it out.
I
Oh,
see.
I should clean up my background too. Look at that. No idea. Oh, and Brian is here. Great.
I'm here on my phone.
Okay.
I'm trying to get on a computer.
Okay.
All right, I think I'm here on the computer because I was getting an echo.
Okay. Well, maybe if I mute myself too when you're ready to start.
Oh no,
we
I
can-
don't. I'm not getting an echo anymore. I turned it off. But I'm here, right?
Well, I
Yeah,
can't
we
see
hear
you,
you.
but here, yeah, I can hear you.
Oh,
And
now
there
I
you
see
are. Hey, great. Sorry you had a busy day at work.
That's okay. It was just I had to
Brian.
plug home very fast, and then my computer takes like 15 minutes to boot.
Oof. Okay, well, you did it, and it's 6 o'clock. So
So. Right on time.
right on time. Fantastic.
Should we wait for Paula or what do you think, Brian?
Yeah, I
For a
think
minute or two?
we'll give her 2 minutes. Yeah.
Okay. Karen, how is month 2.5 going?
2.5 is going really well. Yeah,
All right.
really well, thank you. Just kind of have had a chance now to meet a lot of the key partners and get some of our staffing back up to where we need it. So I'll update you on that. But no, it's going really well. People are really helpful. My only complaint about the job is there's just a lot to it. There's so much going on,
Yeah.
but that's okay. That's a good thing. So, yeah.
Yeah, no, I started a new job last October, so going on a year, and yeah, I still feel like there's a lot to do, a lot to
Yeah.
learn still. So yeah,
Mhm.
never ending. No, but bit by
I know.
bit, more comfortable.
Right.
So.
Right. Yeah.
And apologies, my dog may be jumping on the bed on and off throughout this
That's
time. So you see a
fantastic.
little critter.
Oh, and I see Paula is here as a panelist. So she's probably logging in as well. And we have Shannon and Lucy, and I will introduce Lucy after, tell you about her. But Lucy's our new admin for the department. And Shannon is veterans. Yeah. So I'm going to mute myself, and whenever you're ready to start, go ahead.
Well, I think I was going to start at 6:02, but if Paul is still logging in, then I think we can wait. It says offline. So why don't we start? At 6:02, call the meeting to start. Roll call. I'm Brian Green.
Robert Six, yeah.
And when Paula arrives, I will have her call her name too. So call the meeting to order, 6:03. Approval of the June minutes. We did not meet in July.
Right.
Make a motion.
Second it.
All in favor?
Did
Oh.
you guys hear?
We can hear you now.
Okay, I'm trying to use my laptop today and it's not working out either. So I'm like the struggle is real. You guys can't see me though, right?
That's right, but
No.
we can hear you.
I know, but okay. Try again next time. Okay, I'm here.
Now my face is frozen on my screen in a particularly lovely pose. Can you call your name in for a roll call, please?
Paula Machado here.
Excellent. Hopefully audio is still working even though my screen is frozen. Okay, so Paula, would you like to weigh in on approval of the June 16th minutes?
I second it.
We're past that. You get just yay or nay.
Paula Machado here.
No, just yes or no on the vote to approval. Well, you already
Yes.
seconded. Yeah.
Sorry.
Thank you.
I want to be on board here. I want to see my face. It's frustrating.
So approval is unanimous. We'll work on your face. Controlled substance application. Narcan, are we ready for that, Kara?
Yes, I'm sure that we are. Matt is going to talk to us. Here is Matt, and he'll kind of give you a little overview. And if you have any questions, he can answer those. So, thank you, Matt.
Yes. Thank you, Karen. Evening, everyone. It's been a little bit since I've seen you, but I hope everyone's doing well. Just an update. So we've been doing a lot of Narcan distribution in the city for a while now, but we've been really doing some events over the last few months where our supply of Narcan that we've been purchasing has been going pretty quickly. And the demand is very high. And so Karen told me about a program through the state, which is actually called the Community Naloxone Purchasing Program. And so essentially this program allows us to purchase naloxone through the state office of pharmacy. And so its goal is to increase the distribution of free naloxone to community bystanders. So we submitted an application. Thank you, Dr. Green, for signing that paperwork and getting it over to us. There's one request that they have asked that we're just going to need a copy of your Board of Registration in Medicine license to submit along with it. So if you could send that to us soon, that would be great. But other than that, we're continuing to do, we have Narcan available. We've been distributing it, like I said. We have 3 events coming up. One on International Overdose Awareness Day, which is going to be August 31st. We're going to be distributing in front of City Hall. And then we'll have 2 more in September, one on 9:15 in Union Square and another at Foss Park on 9:30. And I think that's pretty much the update, unless you have any other questions.
When are these dates happening? I would love to participate.
Oh, yeah. So the next one is going to be on August 31st, and that's going to be in front of City Hall from 10 to 4. And
In
then, yep, in Somerville. And then the next one would be September 15th at Union Square from, I think it's 10 to 7, right in front of the Somerville Media Center area, kind of near the bus stop there. And then the last one's going to be September 30th, and that would be at Foss Park, kind of the corner of Foss Park and McGrath.
I will look at my schedule. I participated in the needle exchange program, one of my nursing clinicals, and yeah, it's great. So if I can help, I would be happy to.
Yeah, we'll be there. We have representatives from the Fenway Health Access who also table with us. The Somerville Homeless Coalition staff also, as well as CORE, our police department, our social worker department of the police department. Not only do we give out Narcan, but we also give out fentanyl test strips and first aid, not first aid, COVID-19 tests and rescue breathing masks, face shields for rescue breathing.
So it's a little bit more even advanced in the needle exchange program, which is great, right?
Yeah, so we do an abridged training basically for overdose prevention. Actually, Karen was able to do it last time we had it at Project Soup. So it's a quick, probably 10, 15 minute education to give you really the basics of
let me know.
overdose prevention. Yeah, absolutely. I can send the information out.
Okay, great.
Matt, I think it's been a moment, since we've seen you. And then I think, and apologies if there was a briefing, when Doug was winding down on SUD. But just, I know, kind of in just broader media, right, nationally, the pandemic did not cause a decline, right? It actually caused, an increase in, SUD, right, overdoses, treatments, needs, right, and we're still kind of, I believe, in a high need phase. I don't know if the demand for Narcan is driven by something locally that maybe you could talk a little bit about, but maybe just getting a quick, update on where things are at right now and how the program is sort of responding.
Sure. So yeah, I would say prior to the pandemic, we had a pretty good demand for Narcan. We were doing business trainings and community trainings. Then during the demand, and maybe just because people were focused on other things in terms of wanting Narcan, but we still had it available and we were still purchasing it and we were still getting out to folks. I think more recently, there had been a string of overdoses in the Davis Square area that people were most concerned about, just because it happened in such a quick succession. And there were some concerns about other drugs making its way into the supply that, other than just fentanyl, but there's a drug called xylazine, which I'm sure you may or may not know a little bit about, but it mimics the effects of an opioid, but it is not actually an opioid. So people were administering Narcan thinking that it was an opioid, were not realizing that there was this other substance in it. So that's more still anecdotal and kind of people are still trying to see if that is, but it was something that had made its way over from, it hadn't been in the Northeast, it's been more so west, and I think it was in Pennsylvania or something most recently. And so it was only a matter of time that a lot of the harm reduction folks were saying it may be hitting the Northeast at some time. So this might be a little bit of a glimpse of what that could potentially look like, but Narcan wouldn't be sufficient itself because, again, it's not an opioid, so it's really emphasis on the rescue breathing. That's why we're doing the masks to go along with it, where I think a lot of people still rely on just Narcan because it works, but the rescue breathing is just as important now. And honestly, I think a lot of it is just demand. We've had a lot of people who have said, oh, I'm going to a music concert or a festival or something, and I just want to have it with me in the event that it comes up. So I just gave a bunch this morning to someone or multiple people. I think it was 8 people came and pick it up. So I think people just want to have it available in the event that it happened, especially some of the concerns we have with the Davis Square overdose. overdoses where some of them happened earlier in the morning where there weren't a lot of people around, there weren't a lot of businesses open. And so we kind of want to get Narcan out to anybody that may be out. And we've kind of shifted our messaging to be not just, you know, if you need it because you want to carry it or you know someone that may use substances, but we want people to carry it so that wherever they may be, if they're walking through Davis and someone may be experiencing an overdose, someone would say, does anyone have Narcan? And they may be able to hand it over to them, even if they don't feel comfortable to do it themselves, even though they may know what to do. They'd be there to do that secondary distribution on our behalf. And so we've been definitely connecting a lot with Fenway Health Access, Drug User Health Program, and the Homeless Coalition here in Somerville to get it out to some of the folks that they serve. But we're not turning down anyone. If anybody wants it, you live in Somerville, contact me, email me. I found out my name has been getting onto some Facebook pages. So I've been getting some messages from all over, but as long as you're a Somerville resident, I mean, who knows, even if you're not a Somerville resident, I'm not really questioning. If you want some Narcan, you can get some Narcan, just reach out.
Yeah.
I would just say,
So,
Oh, go
A
ahead.
lot of questions.
go ahead, Paula.
I was just at, so obviously Narcan is readily available, right? It has been for quite some time. However, you just said something that's kind of struck, is other options, and upon that, like, that's what they're relying on, correct?
For the most part, people have been.
It sounds like a double standard, and I'm all about it. I was just curious how they're aware of it, how they're educated about it, because not a lot of people know about it, you know. So when I
Talking
did
about xylazine, you mean?
a little bit, yes and no, but I'm an oncology nurse, so it's a little bit different from where I grew into my nursing career. But back then, when I did my mental health, I worked with Cambridge Health Alliance and the Needle Exchange Program, which I'm all for. However, I still feel like there's a little fine line. I know I'm not going to change this. I'm just advocating for it. It's an easy fix where I want an easy fix. However, for the treatment, these are your options too. So are we doing that?
Oh yeah.
And when
yeah,
I say
sure.
other options, meaning like, all right, here's your clean needle, great. Here's your other options, Narcan, great. However, what are we doing after that?
Yeah, sure. I think a lot of it's some warm handoffs between providers. So we have a lot of the street outreach, particularly going through the Homeless Coalition.
Yeah,
Fenway.
and I love
We
it.
also
Again,
have-
let me reiterate that. But I
Yeah.
just feel like we need to do more if we're going to be aggressive on this sport. This is why I love Somerville. However, I just feel like we need to be better at it.
Sure.
And I'm
Yeah, I
happy to
think
be.
the only other thing I would add is that I know Column Health in Davis Square recently expanded to doing medication assisted treatment, which wasn't something that was previously available to folks in the Davis Square area.
What's it
and so
called?
that was Column Health.
Okay.
And so I know I've done some overdose prevention trainings recently with some of the residential programs that are in Somerville and some of them that are close to Davis Square. And they mentioned that being accessible for folks has made it much easier for them to access medication assisted treatment, obviously, because they can walk right down the street and it's more accessible where they may have had to go further distances to do it. And as you know, you have to go daily for some of them.
I know. It's yeah.
Yeah, and then the conversations still continue about the supervised consumption site. I'm sure.
Yeah, I
Karen,
know. It's not easy for these
we'll
people.
update on that at some point. But the report from Fenway Health just came out, I think a month ago now, that looked at the study for locations, assessments, and things like that. So there's some movement, I would say, on that front as well.
Okay. Thank you.
Mm-hmm.
So 2 comments. One is I think there's excitement in the community about that, and I'm all for the supervised site. The other thing I would say is I'm all for the people carrying Narcan around, and it's actually policy of the VA that we all carry face masks around for doing CPR, and I think that's a good idea. I just, for people who are listening, if you have Narcan, you want to not keep it in the car where it's going to be affected by the temperature. It's not the kind of thing that you want to have at 150 degrees when your car is hot, or -10 in the wintertime. So, so
I
yeah.
have a bunch of it right here. It says store below, it's room temperature, store below 77 degrees and not above 104. So between 77 and 104.
Right. So anyway, it's a good thing to
But-
carry potentially in your purse, but you want to keep it indoors and not in direct sunlight and that kind of stuff.
Yeah.
Right.
I just,
Matt, this is just like my own awareness policy wise. There's a lot of the stuff happening on the T station in the square or near or around it.
I don't know if the T station specifically.
Yeah.
But I mean, I think it's happening
it's
in.
everywhere. If I'm going to chime in on that from family experiences, it's everywhere.
I was going to say it's happening
It's everywhere from young kids. It's actually, and just, I'm getting a scope. We, unfortunately, the Brigham doesn't have an ER. I don't know the VA, Brian, but this is everywhere and it's starting younger and younger. That's why we
I
need
think-
to attack this. We do. I'm sorry, but we do. This is not T station. This is not, and I'm sorry if I'm stepping on toes and getting hot and heavy, but no, this is everywhere. It's too soon. It's too much availability, too much access, too much intertwining, which I'm just learning from other experience. Like everything's just street drugs but everything's intertwined with like fentanyl that it's nothing like I've ever seen or heard of. And I've been involved in the SCAP since 2000 and since my uncle overdosed, probably 2003. No, 2003. And it's just, yeah, no, it's everywhere. It has there's no judgment. There's nowhere it's like particular where it's getting more, less. It's everywhere. It's disgusting.
The only thing I would add.
On that,
No, I was going to say the only thing I would add is that
Sorry.
the
it
majority of
hits
the
close
data.
to home.
Oh no, I totally understand. I think I would just say the majority of the data we have locally is that a lot of the fatal overdoses are actually occurring in residences, so homes
Yeah.
where people
And
may be
it's
using
legit
alone
with-
more often.
Yeah, and it's all classes of families. And it's sad. We got to do better. I don't know how to do better. We don't know how to do better. How's that?
And I only ask Matt to kind of understand the population and like what type of interventions, you guys are looking at. If this is obviously like a holistic problem, then like what may be the prioritization of at-risk youths, transient individuals, homeless individuals, people who, I don't know, right? And then
Yeah,
try to, yeah, and that's what I was trying to get at. When you said Davis Square, I was just thinking, it
Yeah.
might have just been.
No, and
all-
please don't take that in attack. Like I have no utmost respect for all of us here. It's just, it's a mental health that America has totally put to the side. And I can honestly speak for and vouch for that. And COVID hasn't helped and it is. There's no, I feel like back then, 10 to 15 years, we can vouch to maybe that, but now, no, it's the vulnerable that gets fed into it and it can happen to anybody. And how to do better, I agree. It's just, I don't know. We got to puzzle this together.
a few things I would note. I do think there is some stigma attached to unhoused populations that assumes that the substance use is just happening among that population. We actually have a grant. It's called the Overdose Data to Action Grant that we do overdose prevention trainings directly with unhoused or unstable housing unstable folks. So it's kind of a branch off of our community trainings that we specifically tailor training towards our unhoused populations through outreach efforts with the Homeless Coalition and Fenway. For youth use, we're not seeing too much opioid use in the high school and middle schools, at least according to our student health survey data. Most of the youth use of substances is vaping and marijuana, to be honest. But it's not to say that, it can never happen. And there's one other point I was going to say, but I think it's just the stigma is that I think it's happening to all walks of life. It doesn't necessarily have to be just those that are unhoused or transient or youth. It's kind of coming in all different forms. And there's a lot of polysubstance use that's happening between whatever substance may be available, whether it be meth, whether it be alcohol, benzodiazepines. there's a lot of different drugs that are out there. And I think for some folks, they're using whatever they may have available, and that's leaving them vulnerable to experiencing an overdose, maybe because they're not expecting fentanyl to be in it or something along those lines, especially things like Xanax and things that typically fentanyl is not present in, where it's making its way into the supply now more in the illicit supply.
But isn't fentanyl laced with a lot of the new overdoses?
I mean, if you're using a substance, it's pretty much.
I mean, maybe I'm
fentanyl
based
in
in
it.
Boston from my work experiences. Again, I'm not, and this is not my expertise. Yes, as far as what I've been involved in, so forth, I'm not calling it, but like, I feel like what I've been hearing, fentanyl with cocaine, fentanyl with pot products. I don't, that's why I'm asking you.
Yeah, I would say if you're any illicit drug that you're getting these days, it's likely that fentanyl is present.
And then
Marijuana,
Adderall. I just
Adderall,
found out that
definitely,
the other
yeah.
day.
I don't think
That's
with marijuana. I
how-
think that's a little bit of a misnomer. I think a lot of people think it's in marijuana because there's been some fear mongering happening among different
Right.
communities around that. But definitely any like pill or powder based substance like heroin, cocaine, Xanax,
no.
Adderall,
I'm asking
it's
you, like,
making
I know,
its way into that supply.
because Brian, when you were back in Cambridge Health Alliance, I would assume that's more your target. I know either VA, but like, are you seeing any? I mean, it's probably not seeing as much. It's just what I'm hearsay, but it's pretty valid resources. So I'm just concerned.
Yeah, I mean, I think it's, as you said, it's all walks of life. So substance use disorder is a problem in all of our healthcare practices. And actually, there's been some interesting news about the fact that one of the best treatments that we have for this, which is bupropion and Suboxone, requires special license with the DEA that a lot of doctors don't have. And it's a crazy thing because the harms of using this drug are so much less than the drugs that you don't need a special license to prescribe. And so right now, one of the things that we can do as a public health community is really encourage more primary care and emergency room and everywhere physicians to have more ability to prescribe these treatment drugs and more access to those treatment drugs. So I think that is one big thing that we all need to be working on as a society.
Well, thank you, Matt. It was great to see you. Been a minute.
Yes.
Awesome to
We thought we had some tobacco stuff to talk about too, but that resolved itself. So we'll save that for next time with Bonnie.
Okay.
Thank you.
Thank you, Matt. And I'll send you a picture, like I scanned an email of my license.
Perfect. Yeah, that was the only thing they said I was missing, but I was like, we'll get back to you. Don't worry. Thanks again.
Thank you, Matt.
Thank you, Matt. Appreciate it.
Karen, are you next for COVID-19 updates?
Sure. So, COVID, I'm sure you guys are up on where we're at in our community, our wastewater, our hospitalizations, our case numbers continue to decline. So this is all good. CDC made some announcements this week, which again, I'm sure you probably are aware, around not needing to quarantine if you have been exposed. So these are big changes for our community, for our schools in particular, as they're gearing up to head back to school. There's a lot of changes through DESE around what the schools will be doing, and basically they're only going to be offering testing for symptomatic individuals. There's no more sort of test to stay if you've been exposed, those kinds of things. So it's definitely a shift to a movement towards more normalcy in schools. And but again, I think that should be coupled with a lot of education and outreach around paying attention to symptoms. If you are sick, stay home, supporting people with that. So again, same thing we've been talking about all the way along. I mean, I think it's encouraging that there's enough immunity, there's enough vaccination that we're at this point, or that CDC and the state feel that we're there. for now. Who knows what will happen with other variants coming along the way. So we're hoping for boosters, the new boosters that people are interested in. Hopefully that'll come out sooner rather than later. So the nursing team under Elizabeth Kelman's direction is partnering with our schools and our school nursing folks and health folks to prepare back to school messaging, to support them in any of their back to school activities. They may do a clinic, a health fair. They're playing around with what they need to do. They've asked for some support from our team for some flu vaccination as well. So what we would ideally like to do is be able to offer a range of vaccinations and immunizations, as well as test kits and Narcan, whatever else people need at these types of events and clinics. So we're working with the schools on that. Yeah, I mean, I think those are the main sort of messages around COVID and changes. The other thing that I can say is right now our messaging and through our regional group that's doing contact tracing for COVID, we've been pushing out messages, and the folks working on that grant have created a nice flyer that really emphasizes where you can access free test kits. So you can get them online through the government. You can use your health insurance card and get, I don't know, up to 8 or 6 per person in your household every month. So that's a good thing too, that these opportunities are out there for people to access free kits. We're encouraging them to do so, get used to them, know how to do it. And when you have signs and symptoms, do some home testing. So I think we'll see a much more of a shift away from PCRs and large testing clinics and sites to more of this home test kits, and hopefully they'll continue to be widely available for free. So that's kind of what we're seeing in the COVID world right now. I can tell you locally that we have asked DPH, and we're working with our regional partners on our shared services COVID grant. We've asked if we can pivot some of those services to other communicable diseases like monkeypox, contact tracing. So, there are certain communicable diseases that are a heavy lift in terms of contact tracing. They need to isolate or quarantine for long periods of time. There's many contacts, and that is quickly exceeding the capacity of local public health nurses. So, the state is also gearing up to have more capacity to help us should we need it. So, that's something we're watching. We're working with our regional partners. The state has been supportive with additional training for these contact tracers so that they can pivot some of their time to tracing other types of cases that we might need help with. So that's a good thing. You probably know, the monkeypox vaccine was not widely available. We definitely have seen some pressure on the system and access. So hopefully with this new vaccine approved yesterday, we will be able to make sure that everyone who's a close contact who needs the vaccine can get it. Everyone that meets the criteria defined by the state can get it. But that's certainly still not, readily available. It's a concern. That dog is so super cute. It's very hard to, okay, I had to say that.
If I could, I would have blurred the background, but.
No, it's all good. So COVID, unless there's any questions on that, I'll move on to a general update. Anything you are concerned about or want to?
The only thing I'll say about the COVID testing, which I remain all for, is I think we had the 3 ones that the government supplied when I last tested, and the packages don't really have a lot of instructions. So the fact that I went through it 100 times before was helpful, but there's just sort of an envelope that says number 1 and another envelope that says number 2, and it wouldn't be obvious if you hadn't done it a lot. So I think I'm not the only one to have this complaint, but I think it's just really important that the education around information be clear.
Yeah, I will talk with our regional team about that. I know that they at one point were looking at making sure that their instructions were translated and whatnot, but most of the kits I've seen now come with at least 2 languages and pictures as well that are pretty clear, but I will make sure that the kits, we'll do a little assessment of the free kits that are out there and maybe see if we can make sure there's materials that will help people get through it. But that's another reason we want people to use them, to get used to it. And also they expire pretty quickly. The expiration date is sort of a moving feast. They keep extending the expiration, but it gets harder and harder to tell people these are okay, here's the notice, when the date says, you know, last May or something. So yeah, but thanks for that feedback. I will talk with the nursing team and the tracing team on our regional grant instructions.
And then I know you know this, but it's worth just acknowledging that we know this, that the CDC not only said some interesting things earlier this week, but they also said some interesting things today about how they functioned and their communication lapses. And
yeah,
there's going to be more to process about that for a long time. And there's planning on restructuring how they do things, and that will probably filter down to us. And so we're all in the public health world. So I think it's just, I don't have anything deep to say about that other than yes, we know.
right. Yeah, it was a rocky road for a lot of, a lot of organizations trying to manage. So, so moving on to the Health and Human Services update. I could talk for hours, but I'm not going to. Oh,
Karen,
sorry.
just one thing on,
Yeah.
one thing on COVID testing. I think, this is just my opinion, is I think, perhaps there should be some thought and an assessment on, and maybe this is like a more macro, like state or federal level question, but, in public health, always trying to think months ahead. And right now we're getting bit by bit colder and colder. And as we know, all these respiratory diseases pick up, right, come December. And we had, that surprising but not surprising Omicron wave hit us last December. And there just being a huge rush for testing that, I think existing supply found it very difficult to meet, at least within the acute period. So, this is more just like an issue spotting thing. There's a lot more availability of at-home testing. And I hope that now if like the broader strategy is to move to at-home testing, I think it's going to be predictable. There will be some type of surge, hopefully not as drastic as Omicron, but, hopefully the supply of it is enough to meet demand. People are going to be visiting again, winter parties. So I don't know if, again, this is something the city can prepare in ensuring there's some type of local supply to meet, a likely, or if we feel that our public health system, granted, Brian, a lot of good points raised by Rachel earlier this week, if we feel that it's sufficiently, ready to handle another surge with the availability of testing. Yeah. So anyways, a long spiel there, but it's just a consideration for, the winter coming ahead. Yeah.
No, I think it's a very real consideration that there is likely to be spikes. We are likely to, well, at least have a more robust flu season than the last few as people are moving about more. And who knows, we definitely have to kind of think about those things. We do not have, we don't have the curative like army of people or sites, but I think we need to think about and be talking with the city about what our plans might be.
To kick up to DPH, Karen, I don't know how, communicate with them now, but just as a, confirmation of, where the strategy's now at home instead of mass testing sites. So.
Right.
Yeah.
Right. And will that be sufficient? And right.
Okay.
Yes. No, thank you. It's a good point, and we'll leave it on the team's agenda. Okay, so we'll move on to our general updates. So I have been here since June 6th. As I said, when we first began the meeting, things are going really well. My colleagues within the city, as well as the partner agencies that I've been meeting, are wonderful supports. They've been generous with their time and information and knowledge. And I'm getting a pretty good lay of the land a couple months in, so that's fantastic. We are very busy hiring, recruiting, and training for new staff. So as you probably know, during the budget talks, there were several new positions put forward for HHS. Many of them were funded, and then we had additional positions funded through ARPA. So that's fantastic, but it's about figuring out the job descriptions for some of them. For the new positions, we've had to write the job descriptions, figure out where they'll sit and what they'll do. So it's exciting. It's been a lot of work. HR has been a fantastic partner with us. We have several of the positions that are either in the process or recently hired, about to be hired. So I imagine the next meeting I will be able to share some more information on that, which will also allow us to significantly expand our response and our planning efforts and all of these things that we're all worried about and want to be addressing. So I am excited about that. The first position we filled was our administrative assistant position that had been vacant for some time. And we have Lucy Burrows, who joined us from the Treasury's office. Lucy's been here 3 or 4 weeks now and is doing a fantastic job getting systems in place, training me. Lucy has been in the city for a very long time. She knows a lot of the ways in which the city works and the admin. So very grateful for her and for Shannon Henry, who did all of the training for Lucy and also filled in during the very long gap. So we have the administrative team in place and they are fantastic. And then we have Denise doing our grants. So we're trying to have cleaner lines of responsibility and support our admin team in supporting us to do the work we're doing. So we are also about to embark on a goal setting process in conjunction with Somerville. So we're excited about that. We'll be taking some of the mayor's priority initiatives as well as our budget asks and initiatives, and then having a look at the summer vision goals that were set previously. So Somerville is doing a fantastic job putting that into some kind of a structure or database that we can then start to measure our goals. And several of the conversations we've had tonight have talked about things like, Narcan, how many times, or overdose calls, where are they? Needles, where are they found? What is the size of the issue? So all of these things are going to really help us fine tune our priorities and stay focused. It will coincide with the release of the Cambridge Health Alliance Needs Assessment, which they do every few years. So we're excited that will be coming out, and then we'll be able to have a lot of data and a system and a structure to work with the data and apply it to make decisions and to track our own progress on our goals. So Somerville will be joining our September leadership meeting and doing a workshop with us on our actual goals and helping the divisional directors come up with the strategies as well as the SMART goals and things we'll be measuring. So excited about that. In terms of harm reduction activities, we talked a lot about that with Matt. He's the expert. He's doing some fantastic work. I just wanted to highlight a couple of things there that we are looking at any gaps that might exist with our harm reduction services, what other needs might be in the community. And we know there are some, so we're working with our partner Fenway and the state to make sure that we're sort of honing in on gaps in Somerville and enhancing those services, especially in light of conversations about a safe consumption site that is probably not likely to have the full range of comprehensive services that we would like offered in at least the first or the shorter term. So I think that understanding our harm reduction needs, the data, and then where the gaps are, who can help fill them, is a very important first step as part of our planning and developing of a larger comprehensive services for persons who use drugs and harm reduction activities. So in terms of the safe consumption site, I'm sure you know, over the summer, a report came out from Fenway that talked in a lot more detail based on the needs assessment, kind of came up with some feasibility, some couple of different options at different sort of pay. You know, for this amount of money, you can offer these services, and for this amount of space. So it's a great report that if you haven't had a chance to have a look at, I encourage you to do so. We've had lots of response from the community, lots of interest, lots of involvement, lots of concerns, lots of questions, which is great. So, you know, right now the city with our team is kind of figuring out what next steps are with some of our partners as well, and what we need to know to move this forward, and what the process will look like. So we will circle back to you on that. And unless there's any questions specifically on that, I'll keep going. No. Okay. There's been no, you know, definitive site or size or any of that. So the other thing that we've been very cognizant of this summer is heat, obviously. So again, working with our partners at the Coalition for Somerville's Coalition for the Homeless and the Housing Authority, talking with them about their short and long-term needs around heat exposure, living conditions. There are many elderly units in Somerville, almost 700, and they gave out 20 air conditioners this summer. So that's great. It's a good start. It's not sustainable. It's not, you know, it's an area of concern. So there is a city group that meets regularly with the sustainability office and lots of different folks to really hone in and work on this issue as we see more and more heat emergencies or extreme heat. Thinking about workers and athletes and young people who are outside all day at camps, working DPW jobs or landscapers is kind of one category of risk, seniors, and then homeless. So those are our 3 focus areas at this point. A lot more work to be done, but we're exploring spaces that are safe and cool for people to congregate during the day when shelters are closed and things like that. So good work happening there, a bit of a process that will segue the emergency plan that we're working on, and the community plan will segue into a heating space, a heating shelter, or a heating centers, more in a charging center, those kinds of things. So more work to be done there. The YRBS data is in. It hasn't been widely presented yet. We will support the school. Matt has largely run with that initiative. That's the Youth Risk Behavior Survey that we do every year here. We had a great meeting with JSI, who's our data evaluator, and they are excited to partner with us this year to explore ways that we can take the data with the school community and the students and action, you know, move forward on some of the areas of concern as a community. So we are kind of in the process of working with the acting superintendent to figure out what that might look like. And we've proposed that we pause and maybe do every other year with the data collection. So it will allow the school community folks and JSI, the evaluators, to really dig deep and spend that off year exploring the data and maybe, you know, moving some steps, some actionable steps on that. So that's exciting, and we've had a couple of good meetings at this point with the school to really think about that. I think that those are really the main things I wanted to talk with you about and highlight. There's obviously lots of great activity that's continued all summer with our mobile markets, our youth programs of youth employment, all kinds of things, and then the usual business as usual. But those are some highlights, and if there are other things that you specifically would like to know about or hear about, I'm happy to provide more information.
Yeah, only to say on the earlier point of working on the community health needs assessment, that's great. It's been what, since 2017, so a little overdue, but understandable with with a little bit of delay. So yeah, I think as you make your work, and on making these assessments, would be great to hear like some high level findings and trends that you're looking to target in the next draft of our assessment. So yeah, that'd be, I'd really enjoy hearing more about that in the future.
And you will, for all of these things I've talked about, including the goal setting process, we will come to you with draft goals and share them with the board and have conversations and see if we're all on the same page. So I look forward to doing that with you guys as well.
Great, thank you.
And congratulations on the proverbial drinking from the fire hose of all the exciting things that we have going on in Somerville. I hope you were sufficiently warned when you applied for the job, the number of things.
Yeah, no.
Agreed with all.
Sounds like you're getting a handle on the breadth and the depth.
Yeah. I mean, there's always more. You always want to be able to do more in this field, but I think if we focus and prioritize, that's important too.
And give yourself credit for all what we could only do so much, right? Per second in one moment.
Right,
So,
exactly, Paula. And I think if I
I mean, I feel like I do that in my profession. I'm sure Brian, in addition to like any profession, it's unfortunate. The world we live in, it is what it is. I hate that saying, but it's the truth.
Mm-hmm. Yes, Paula, I agree. And I think that one thing I have learned in the last few years of working in local public health is you can't do it alone and you can't do it all. And so it's exciting to partner with our partners out there and connect dots where, how can CHA help us with a COVID clinic, peds, if we do the flu and they do, so these are the kinds of ways that we can really all, move the needle further by partnering. And that certainly, Somerville seems like a place that's really happy to do that and used to doing that. So that part is exciting. And Doug Kress, being our previous director, being at CHA and being so open and willing to partner has been fantastic as well. So, I think there's a lot of opportunities if we kind of take a minute to put our heads together and make a plan. We can find some ways. And again, for all of these harm reduction services we've been talking about tonight, there's a lot of players that if we can kind of pool our efforts, we'll be able to move the needle, I think, too. So thank you, though. Okay, that's it.
Well, we still have body art license follow-up.
Oh, yes, we do. Yeah. Okay, so I can take that one.
I'm so sorry to interject. One update, and I know you touched on it. Just I don't know if you could just refresh my memory on monkeypox real quick, because I know it's top of mind for certain people. Yeah.
So it's a communicable disease. It's spread through open sores, rashes. Dr. Green can probably do this better than I can. And so for the health department, it's about getting the message out to our wider community that if you see the sores or you think you have any of the symptoms, to get tested, or again, harm reduction stuff, to try to keep that physical distance, use protection. It's usually transmitted during sexual intercourse. The population that's been hit the hardest in our area in America, in Massachusetts, I think pretty much nationwide, are men who are having sex with men. But it's not a disease that is isolated to any one population. It's an open sore, and that can get onto soft things like towels and blankets. So if people are sharing in a household or in a roommate situation, there can be some transmission through shared items and clothes and towels. So it's all that kind of education we're trying to get out to folks. It's handled like any other reportable communicable disease. So if there is a case that a doctor or a PCP or a clinic identifies and it tests positive for monkeypox, it would go into the MAVEN database like influenza, Lyme disease, COVID, any of these sort of other TB reportable communicable diseases through the state. That would get pushed out to the local public health nurse, who would be responsible for the contacting of the patient to go over their condition, talk about precautions, talk with them about the isolation protocol, and then to reach out to close contacts. So that's where we're finding that. And the conversations, obviously, given the transmission, the modes of transmission are sensitive conversations about people's sexuality and close contact exposure. So it takes some time, and they're sensitive conversations that the nurses need to have to go through, identifying close contacts, what does that mean, and then contacting the close contacts. So, much like in early days of COVID, it's quite a lengthy process, and we're really limited with resources. So when we identify close contacts who are still within the window that they can get the vaccine, we don't have enough appointments and places to send them. Sometimes we send them somewhere and they're told, you don't meet the criteria, so they come back to us needing help accessing at least the first vaccine. It's a 2 to 3 week sort of quarantine isolation period, I believe, for both the isolation and the quarantining of close contacts. So one of the things we've been talking about with Tufts is in our college community, what that's going to look like in a college setting if there is an outbreak, which, or a small cluster or something. It's possible, probably likely at some point, that there'll be this kind of thing happen, and we'll be responsible for the tracing, but Tufts will be responsible for partnering with us to help isolate those individuals and make sure they can continue on their learning plan for that extended time. So I think those are some of the really big challenges with this. There's also been stigma, as you know, that's a problem in messaging and helping people understand what monkeypox is and isn't. So we've done some work with basically kind of forwarding DPH fact sheets and communication tools to our communications team that gets the message out. And we're going to, in a week or so, we're working for another kind of public health messaging outreach to talk a little bit about COVID, a little bit about monkeypox, and a couple of updates and things that people need to know.
And Karen, is there any data from MAVEN on the incidence of monkeypox in the city? Yeah, if you'd be able to talk about that, or it's too premature?
Yeah.
So.
No, I mean, we're not unique to other communities around here. We have a small handful of cases, and close contacts, lots of close contacts that need to be followed up. Sometimes the case is a resident of another community. So the contact tracing starts from where the positive case is a resident. So we've had folks who are residents of other communities, but they maybe work or have contacts in Somerville. So we get involved in the tracing in that. And again, there's a kind of triaging the nurses do in conjunction with the state around congregate living. If there was an exposure in a site where there were congregate living or, a lot of people together, high risk individuals, obviously that's going to get flagged. The state has, been very supportive, and when we asked about a situation like a larger cluster, if it were to happen in a congregate living or at a place like our universities, how would that get handled? And they've said, like COVID and everything else, you do what you can locally and in conjunction with other agencies, and then we would request additional support from the state. But that's why we really want to make sure that at least a couple of our COVID tracers are also trained for other diseases and can support our very small team, which right now is 1.5 nurses here in the department. We are hoping to hire soon another nurse, which will be great, but it's still a small team for all of the responsibilities of public health nursing.
Thank you so much for that, Karen. Really, really helpful to hear everything that you've done. Some examples, yeah, some of the challenges that I think a lot of communities are facing. So yeah, no, appreciate that, and hopefully it's useful for anyone else who's listening. So.
Yeah, and I think to remind people that, you know, COVID might not be in the news every day, and we might not have a mask mandate here in Somerville, but I think it's important to remember that our public health nursing team is every day seeing what's on Maven. And if we see anything of concern, if we see a spike in TB or a spike or a cluster, and so I think that helps people to feel a little bit reassured that if we do see an increase in activity in any one of these reportable communicable diseases in our high-risk population, in a healthcare population, we will be acting very swiftly and addressing that and reaching out to partners in the state. So, yeah.
Great, thanks.
Yeah.
I do think at this point, high-risk populations, and in this case, right now, it remains men who have sex with men, should be considering vaccines. And for people who are not in that population, it's harder to get the vaccine. And I don't know whether people want me to recapitulate the stuff that's in the news, but I would just say that there's two ways to give the current vaccine. There's the way that the manufacturers suggest you do it as an injection and intramuscular, and then there's a way to do it that's underneath the skin that has a slower absorption. And if you do that, you can spread the second way. You can spread the supply that you have longer. So you can give smaller doses and give it to more people, but the manufacturer is not loving the fact that the government might be recommending that is one problem, and there's a whole political issue around that. And the other is that not all the people who give vaccines are trained to do it in this particular way. So part of the slowing down now with the rollout is that there's a training process of the vaccinators so that they can give the vaccine in a way that spreads the supplies so that we can get more of the population, and hopefully that will work its way through in a little bit, but it's yet another thing that's preventing the rollout of the vaccine at the speed that we would like it to be.
Yeah.
I'm trying to make this as value neutral as possible because there's a lot of controversy. But anyway, that's one of the issues. And then the only other thing that Karen, you didn't say that I just think is worth saying since we're in a public forum is that it's not called monkeypox because it's exclusive to monkeys originally, or it came from monkeys. It's called monkeypox. This is a known pox virus that's had a long history that has been in populations before, but the first case that we isolated of it came from a laboratory that saw it in monkeys that they were researching. So in medicine, we often name these things remarkably dumbly, like, you know, saw it on the left, so we're just going to call it the left virus, and this is one of those moments. But it is in fact a virus that is in the family of smallpox, and so the vaccine that is available is the vaccine for smallpox that we stockpiled back during the Bush era, and it's not 100%. We don't have the data yet about how effective 100% that vaccine is for this virus because it's too early in the process to know. Just like in the beginning, we didn't really have really good data on how effective the vaccines were for COVID because we didn't have the numbers. So I think the recommendation is we we strongly recommend, if you are in the population of men who have sex with men or live with men who have sex with men, that you consider getting the vaccine. And for the rest of the population, I think it's a pretty low risk right now, and we are going to work on spreading the vaccine and given the resources.
Thank you. Yeah. Good additions. We ready to move on to body art?
I'm ready.
Same.
Okay. So there isn't really a huge update there. As you know, at our last meeting, the board voted upon request to review and to pause all body art license fees until there can be a review of the fee. So unfortunately, it created the notices had already gone out for folks to renew those licenses. And so our friends at ISD did a good job of kind of reaching back out, and but it was rather labor intensive. They have notified all of the artists at this point and put on the website that there is no fee at this moment. And it's been asked by the finance folks that there be a more comprehensive review of all of the permit fees for health inspections. So that is the last conversation that I heard about it. The decision after, I mean, I think there was a little bit of confusion whether or not it was within your authority to do this at the last meeting, and I can say that yes, the legal team reviewed it and agreed that yes, it is within your authority. But the finance folks had lots of other questions and concerns about I don't know, finance law and the state and a bunch of stuff so they've just asked that if we are going to make changes to fee structures or things like that, that we consult with them first and hear the different sides. They also raised just that equity question of waiving it for one group and not other groups that may also feel that their fees are disproportionate to their profit or other communities. So I thought that was a fair comment. So I don't really have a whole lot more other than to say the order that you voted on went through. It's been paused, the fees, and it's being reviewed. And I don't know, we'll be involved in that and ISD, but it's really predominantly sits with their permitting system and whatnot. So that is that, unless there's questions for me.
Only that it sounds like we should look at the totality of our fees before this comes up next time.
The what fees? I'm sorry.
The totality of our fees, the way.
Oh, yeah. Okay.
Yeah, I mean, all valid points, I think, result of transition, deadline coming up for the fees, I think strong advocacy. So yeah. I'm trying to find some type of solution, interim solution. I totally see that and do recognize and appreciate the city's administrative efforts to try to work with that, compromised solution that, I know I had proposed and Brian, you had offered. As always, great advice on, but, hopefully it's something we can now take a broader look at and, yeah, resolve and address a lot of the issues that Councilor brought up. So.
Okay. Thank you for that update.
You're welcome.
The only thing I was going to say about when you were talking about COVID that we moved past was just that I would mention as a employee of a large organization and a manager that we seem to be having a fair bit of outages for health reasons that are virus and not COVID right now. So, so testing to show that we are not having COVID is interesting because it's showing that there's a lot of virus right now that seems to be spreading because the summer and people are traveling. So when, Robert, you were talking about the fall and flu and stuff like that, that actually right now in the summer, there seems to be a fair bit of non-COVID virus. So I just bring that up. Other than that, the next meeting is scheduled for September 15th, which is, I think, okay.
That works. I'm trying to plan a trip to Portugal, but I could always zoom in on that, so it's okay.
Nice.
We'll see. But
Factor in 6 hours ahead of us, so.
four. It's
Okay.
legit. If no one's been, it's such a hidden gem. It's like, I'm actually from the Azores. It's a little over 4 islands, 4 hours to get there. It's absolutely stunning. It's 9 islands, hidden gem. I haven't seen my family with COVID and new jobs and stuff in 4 years, so got vacation improved. Just a little things I have to figure out, but I can always chime in on that. It's not a big deal.
Oh, I've been to San Miguel. Gorgeous.
Oh, that's where I
Yeah.
was born. I'm not going to bore
Gorgeous.
everybody, but yeah, I was born in Punta Delgada, right in the city.
Yep, I went there, yeah, with a friend from there, and it was fantastic. But maybe don't advertise it too much. It was nice to be
They
in.
don't. Hey, let's keep it that way. But hidden gem, right?
And Paula, I almost went. I had tickets to go right before the government
The COVID.
stopped traveling because of COVID.
Same. Should we do a Board of Health traveling thing and have a meeting there? It's legit, Karen. It's a little over 4 hours.
Yep.
I'm very close, very close.
Oh, you got to go back. I mean, I'm biased, but everyone speaks English, super friendly, cheap when you get there. Wear a lot in a good way, but yeah, it's fantastic. A lot in a good way. I'm making fun of myself. You know me, Brian, out of everyone. Like we are, but yeah, no, it's great. I just had a nursing friend that went. She's Brazilian. She goes, Paula, why did you move here? I ask my parents this every day. Yeah, it's beautiful. And it's just easy. It's a one-stop shop, and yeah. Brian, you gotta go.
All right. Well,
Yeah,
I think we've moved out of the public health part and into the travel.
We'll put that in the agenda. Last item. Can we get a budget for that?
Recommendation in the minutes, but if nobody has any other health issues, then I make a motion to adjourn.
I second it.
7:09 p.m. See you on September 15th.
great. Yes,
All
thank
right.
you, everyone. Have a good night.
Have a good night, everybody. Take care.
Bye-bye.
Hi, guys.
Still. Show the control panel.